evening. I'm Lee Anderson. Healthcare providers in Central Oregon have signed a petition demanding action from executives at St. Charles. Alec Nolan has more on their concerns as COVID cases surge.
Nurses here in Bend are fighting for safe staffing as well as COVID-19 protections, while they say St. Charles is playing a blame game. Nurses in Central Oregon have delivered a petition to executives of the St. Charles health system with a list of demands. Those include providing adequate personal protective equipment, access to COVID tests, sick leave, and an apology.
It's a bit of a slap in the face.
Nurse Corey Sattler from St. Charles Bend says executives have incorrectly placed blame on caregivers for the hospital's COVID-19 cases. Sattler says back in April, St. Charles leaders plastered the hallways with signs and quotes calling them heroes. Now, with staffing levels low, they are blaming caregivers for bringing the virus into the workplace. The Oregon Nurses Association says caregivers are contracting the virus at work because St. Charles is failing to protect them. Sattler added that nurses on the front lines are not even regularly tested.
We do not have a regular testing schedule for nurses at the hospital. There are many places that do. The hospital is not one of them. We are not tested regularly. We are only tested if we show symptoms.
Sattler says sometimes even if they show symptoms, they're only told to mask and monitor at work. I asked Sattler what would he say to those who say this is what he signed up for.
This isn't something we signed on for because this isn't something that any of us expected to see or have seen. This is brand new territory. So yeah, we signed on to be caregivers. We signed on to take care of our community, but we didn't sign on to be treated as a number. We signed on to be treated as a nurse.
We reached out to St. Charles for an interview, but they declined. They did, however, provide a statement stating, "Since March, we have tested more than 640 caregivers for COVID-19, 54 of whom have tested positive. With roughly 4,500 caregivers, that means 1.2% of our workforce has contracted the virus, a number that is on par with what we're seeing in our communities." Dr. Absalon went on to add, "For every positive case, we conduct a follow-up investigation to determine the source of exposure, and with rare exception have found these to be community acquired." Put another way, in spite of caring for patients with COVID-19, our caregivers are not commonly contracting the virus in our facilities. Sattler says he and his colleagues will continue to provide care for those in need, but they hope for work improvements in the near future. In Bend, Alec Nolan, News Channel 21.